And I call the member for Bennelong.
Deputy Speaker, I'd like to thank the member for Macarthur for the opportunity to talk about how Labor was elected to strengthen Medicare and how the most recent budget continues on with our election commitments. Because we know, Deputy Speaker, that only Labor can strengthen Medicare. Labor created Medicare, will protect Medicare and will strengthen it. And with the 2024 budget, we are taking further steps to reverse the cuts and neglect of the Liberals by enhancing the accessibility, affordability and quality of healthcare services nationwide. And I'm very happy to be able to say, Deputy Speaker, that the government will significantly strengthen Medicare in Bennelong. Deputy Speaker, from the 1st of July, Bennelong will get its first federally funded Medicare urgent care clinic at Top Ryde Shopping Centre. It will be open 7 days a week, for longer hours, be fully bulk billed and accept walk-in patients. No matter who you are, what you do or what you earn, you'll have access to the Top Ryde Medicare urgent care clinic. And that access will be fully bulk billed with no out-of-pocket costs, because Labor believes that to get urgent care, all you should need is your Medicare card, not your credit card. Funded in the budget, the Top Ryde Medicare Urgent Care Clinic is an upgrade on the New South Wales Health Run Clinic. From 1 July, it will operate as a federally funded clinic, and it will help significantly alleviate the pressure on the Ryde Hospital Emergency Department. Last financial year, almost half of all the presentations at Ryde Hospital were for conditions that could have been managed in a less acute setting. By shifting these cases to the Top Ryde Medicare Urgent Care Clinic, patients will be seen more quickly and emergency departments will be reserved for the most critical of cases. The $227 million expansion of the Medicare Urgent Care Clinic program announced in the budget will establish another 29 clinics across the country, bringing the total number of Medicare urgent care clinics to 87. And the impact of these clinics, Deputy Speaker, in communities is already evident. Since the first sites opened in June 2023, the 58 existing Medicare urgent care clinics across Australia have handled over 400,000 presentations. In New South Wales alone, the 14 existing clinics have seen more than 65,000 visits. And, Deputy Speaker, Bennelong will get its own federally funded urgent care clinic in a few weeks' time. It doesn't end there. From July 1, 2025, Bennelong will get its first public MRI licence as part of a $70 million program to increase the number of public MRI machines. Currently, local residents don't have local access to fully funded Medicare-billed MRIs. Our closest public machines are at Royal North Shore or Westmead. Locals had a choice of either being hundreds of dollars out of pocket or to travel out of area to get important MRI imaging. This expansion from 1 July 2025 will profoundly impact the accessibility of MRI services for everyone in Bennelong. It means that the current MRI machine at Macquarie University Hospital will shift from a private licence to a public one. It will help patients access affordable and world-class health care right at our doorstep. And with more public machines available, patients will experience shorter wait times and quicker, cheaper access to essential imaging services. These machines are crucial for early detection and treatment. Deputy Speaker, since we were elected, we've remained committed to strengthening the healthcare system and providing tangible relief from cost of living pressures. From tripling the bulk billing rate, making medicines cheaper, funding urgent care clinics and MRIs, we are a government that is undoing the cuts and chaos of the Liberals and Nationals. Contrast our record compared to those formerly in government. We know that when he was Health Minister, the Liberals Leader of the Opposition froze the Medicare rebate, a freeze that remained in place for a long 6 years. He froze it, we tripled it. The Liberals Leader of the Opposition also cut $200 million out of the system aimed specifically to reducing demand on state-run emergency departments. He put pressure on those departments. We're opening urgent care clinics to take pressure off. And under the Liberals, the Leader of the Opposition tried to jack up the price of medicine by adding $5 to every script. He wanted to push up the cost of medicines, and we've cut them, saving locals in Bennelong almost $2.5 million in 2 years. The difference couldn't be more stark, Deputy Speaker. The Liberals opposed, froze and seek to attack Medicare. Under Labor will continue to strengthen it.